My name is Dr. Dineo Khabele. I'm professor and chair of obstetrics and gynecology at Washington University in St. Louis. I'm a gynecologic oncologist and physician scientist. My affiliation with the Ovarian Cancer Research Alliance is I'm on their scientific and medical advisory board, and I'm the chair of the Early Investigator Career Awards subcommittee. The Ovarian Cancer Research Alliance was pivotal in launching my career as a physician scientist. My first ever grant was awarded by the Ovarian Cancer Research Alliance when I was a gynecologic oncology fellow in training. So my first faculty job, I actually had a grant that I brought with me and allowed me to generate early preliminary results that eventually led to more grant funding and eventually establishing my own lab in ovarian cancer research that I've had since 2001. Ovarian cancer describes a variety of cancers that really start in the ovaries and fallopian tubes. Most of them probably arise from the fallopian tubes and land on the ovaries themselves and spread throughout the pelvis and the abdominal cavity. The types of ovarian cancer that are most severe are the ones that spread without us being able to detect them early, and that's how they affect a person's body. Well, the question is ovarian cancer more deadly among Black women, even though it's not as common. What we can do about it? Well, essentially it is usually diagnosed at late stages of disease, not just for Black women, but for most people diagnosed with ovarian cancer. And it's disproportionately affecting Black women and being misdiagnosed or diagnosed too late. One of the ways we can overcome this is really by educating people about family histories of cancer, such as ovarian and breast cancer, and trying to get people tested for these hereditary mutations that can cause cancer and getting people interventions earlier. Ovarian cancer is not as common among Black women, but unfortunately it's disproportionately more deadly. They're more likely to die of ovarian cancer disproportionately. And in part, this is because it's diagnosed late. Unfortunately, late diagnosis of ovarian cancer when it's already spread is not just amongst Black women. Most of the people diagnosed with ovarian cancer, this is what occurs, but this disproportionately affects Black women. And part of it is there's misdiagnosis. They're sent to different doctors as opposed to gynecologists and gynecologic oncologists who take care of this condition. The other way we can overcome this possibly is educating people about family history and genetic risk for developing ovarian cancer. And if we can identify families and people are talking to their families about this, maybe we can identify risk factors, genetic risk factors, and intervene with surgery or other things, more surveillance, watching people closely to prevent ovarian cancer from happening in the first place. Signs of ovarian cancer people should be aware of include the belly being swollen, abdominal swelling, bloating, feeling full early from eating, not being able to eat as much, unexpected weight gain or weight loss, abnormal bleeding or discharge, and a big change in bowel or bladder habits. And as you can see by this list, these are very nonspecific symptoms for ovarian cancer. And unfortunately, many of those symptoms happen when it's already spread. But we like to tell people to look out for these symptoms so that the diagnosis is not delayed even further. Well, I think it's really important to get to the right type of doctor. We normally want people to start at least with their gynecologist for an initial workup, which involves taking a detailed history, including a family history, performing an exam, including an abdominal and pelvic exam. And then if there's something suspicious on that, to then get some diagnostic testing, which would be imaging and maybe a blood test. That's really important. Unfortunately, we don't have any screening tools for ovarian cancer, so these diagnostic, trying to figure out what's happening, tests are really important. We don't have any early detection tools or screening tests that work very well. And so a lot of our efforts on prevention have been really focused on family history, genetic testing, and intervening before a cancer develops by removing the fallopian tubes and ovaries. And in some cases, there are clinical trials where we're looking to remove the fallopian tube first, wait for menopause or wait for an older age to then remove the ovaries, because a lot of ovarian cancers may start in the fallopian tube. Another method of prevention is actually combined oral contraceptives, birth control pills, and those can prevent ovarian cancer. So I wanted to follow up on family history and genetic testing. I think that if there's any hint of a strong family history of ovarian or breast cancer, that it would be important to undergo genetic testing. Genetic testing is really important, specifically for genetic mutations that are passed down from family member to family member, because that can help determine the risk factor for cancer. If a person is tested and found to have a genetic mutation, then we can intervene and actually possibly prevent that person from developing cancer. So that can save a person's life. For prevention, we're focusing a lot on family history. So if there's a strong family history of ovarian and even breast cancer, we're recommending that people undergo genetic testing to find out if they're at risk. And if they're at risk, then there are surgical options that we have available and other options for close surveillance and possibly birth control pills if you're not done with childbearing. The surgery options include, we have national and international studies right now looking to see if we can just remove the fallopian tubes. And then once a person is closer to menopause or a little bit older, then to remove the ovaries at that point. We don't know exactly what these studies show, but we think that that's going to delay surgical menopause in many people, which helps with quality of life. When we talk about Black women interacting with the healthcare system, we know that there are a lot of difficulties in being heard by healthcare providers, including physicians. And it's very hard to advocate for oneself because people are worried that they'll be seen as not being a good patient or be dismissed even further. And I think that we have a lot of work to do in healthcare to be more caring, to listen better, and to really train a more diverse workforce. And that's one of the things that I'm interested in doing, so that we have more Black doctors, nurses, healthcare providers. And I do want to put in a plug for the National Medical Association, where there's a gathering of Black doctors. There's not enough of us to take care of the entire population. So I think it's really important to spread the word about culturally competent and culturally sensitive interactions with patients. And patients themselves, I recommend you bring a partner with you to your doctor, a second set of ears and eyes and heart who can help you through this very difficult journey. How to find the right doctor is something that's so critically important in cancer care, cancer prevention, and healthcare in general. I think about how you want to be comfortable with your doctor. You want a trustworthy and trusting relationship. And so I don't have a problem with people seeking a second opinion if they're not comfortable with me as their doctor. And I encourage it. And I think it's fine, it's okay to switch doctors and switch healthcare providers if you don't feel comfortable with what you're being told. And sometimes people feel comfortable with me, but still want a second opinion. And I always encourage that. I think it's important for you to get as much information as possible as a patient and seek a second opinion from reputable sources now. I sometimes have patients who get opinions from, the street doctor and their grandma, somewhere else. And so I think we have to be really careful about that, because that's the kind of information you want to help support you through your journey, but you also want a second opinion that's medically and evidence-based. If you go to the Ovarian Cancer Research Alliance website, there's a tool on the website to help you find a doctor. Clinical trials are so important, especially in ovarian cancer. There are not enough clinical trials for ovarian cancer treatment and prevention and early detection. Clinical trials actually save people's lives because this is a way for us to test new treatments, develop the evidence to see if this is something we can offer more people. And I have to tell people, I actually am an investigator who participates in enrolling patients in clinical trials. And we talk about the fact that they're very well regulated. We do not sign anybody up for something they don't want to do. So there's a lot of counseling, there's a written informed consent, there's a mountain of paperwork people have to go through to understand their role in the clinical trial. And more importantly, at any point in time in a clinical trial, somebody doesn't want to continue, they stop. And they can say, I don't want to be on the trial anymore. And they're taken out of the trial and their data is removed from the trial. And so understand the concerns that people have, particularly in the Black community, because of how the healthcare systems have not always been kind to us, the extensive history of wrongs that have been done to Black people through healthcare and through some of the trials that have happened in the past. I'm not going to be able to reassure every single person, but I've got to say that the regulatory and the oversight of our current clinical trials is pretty intense. And you're not only helping potentially yourself if you get first and early access to a new drug that may be better than what we've had before, but you're definitely helping other people who've been affected by ovarian cancer. On the Ovarian Cancer Research Alliance website, there's a clinical trials tool which helps people who are interested in becoming a participant in a clinical trial find trials in their area. So endometrial cancer is a cancer of the lining of the uterus, and it's the most common reproductive cancer in the United States. As a Black woman, as a patient, and as a physician, I know that we are brought up to take care of everybody else first before ourselves. And what I say is, if you have any of the symptoms we've talked about today, any family history of cancer, please go to see your doctor. Please take a friend.